you new to the area? Or maybe you just need to find a new chiropractor? Whatever your situation, looking for a chiropractor isn't easy. How do you know the right questions to ask? How do you find the right fit? Don't worry, it's easy with the right approach. Today we're catching up with a local chiropractic expert who will help you find a chiropractor that will have you feeling your best.
Well, that's a great question. This is Missouri, the show me state, so it's really up to you to find out how this person's going to match with you. You know, you can check with your friends and family. You can also check their reputation on the internet, go to the state associations. It's a lot like finding yourself a family practice doctor or a dentist. A lot of times you just got to find the one that matches your personality and who you like. If you don't find the one at the first shot, keep trying, because you know what, you need the care. So for a good example, just recently I had an internet search for a good chiropractor here in the local area, and a scientist at a large corporation just not too far from here searched chiropractor near me. And she's had headaches, she had back pain, headaches probably 2 or 3 times a day, and we just got done with her treatment plan, and she's about 2 months right now without a headache. It's just been a great success, and it's all because I had a great internet reputation and people could find me that way. So some points that make me different than others, or just kind of set me apart. My mission statement for my office and for who I am as a chiropractor is I want to meet, treat, and change everyone's lives that I possibly can. So in order to do that, I need to get out there and find people where they're at. I don't just sit here and wait for people to come to me, as much as that sounds nice, but less than 8% of the people in the United States have ever been to a chiropractor. I want to go find that other 92%. So what I do is I go to corporate events, I go to public events such as bike races, runs, other things like that, or even going to gym fairs or anything such. But then once I get to meet the people and I get to know if they have a real problem that needs to be fixed, I invite them into the office so that we can actually assess, find what's wrong, and correct it. And then when we're doing that whole evaluation process, I also interview them to kind of find out how their pain syndrome has changed their life. Is there something that they're lacking, something they're missing, whether it's a grandma that wants to play with her grandkids on the floor, or if it's somebody that's 20 years old and in college and can't study because they can't read a book without getting a headache. It's those things that make me drive to find anyone I can to make it possible so they can have the lives they deserve to have. Now, a lot of the reasons why people have these problems results all back to about 3 different similar problems. 1 is inflammation, 2 is instability, and 3 is weakness. Now, inflammation is a result of the body trying to heal itself, but it does it in a very poor fashion if you've had the pain for a long time. So what we want to do is we want to find out why you're having that inflammation. A lot of that has a lot going to do to the instability of the spine. Sometimes segments are moving too much, or sometimes they're not moving enough. So that's my job to find and correct those. And also the reason why they're unstable is because there's weaknesses, and it's not usually because of the weaknesses of the strong muscles on the exterior of your muscles. In your spine, you have anywhere from 3 to 5 layers of muscles, and it's usually the most deepest muscles that are the weak ones. So my plan is to treat the inflammation, treat the instability by also treating the weaknesses from the inside out. Now, one of the things that have set me apart in my treatments just recently in the last 4 months is I've actually introduced a class 4 therapeutic laser to enhance and advance my treatment plans that in the past used to be anywhere from 20 to 30 visits to get people back to the lives they wanted to live. But now I can do it in anywhere from about 10 to 15 visits. So it's cut my treatment times in half. So the faster results, the greater responses, people are smiling and telling everyone about it. Now also another quick thing just that might set me apart from others is that I've got 5 degrees, not just my Doctor of Chiropractic. I have a Master's in Sports Science and Rehabilitation and 2 bachelors, and one of those is in Exercise Science, and also an Associate's in Sports Medicine. So I've been working with the human frame in all different kinds of capacities for the last 15 years. So it's not just my time as a chiropractor. I've been working on injuries for a long, long time. So if you want any more information about Ernstrom Spinal Rehab, please go to our website or give us a call. And remember, at Ernstrom Spinal Rehab, our philosophy is to meet, treat, and change your life.
And there you have it. With the right chiropractor, nothing is impossible. It really is that simple. Would you like to learn more by connecting with today's expert? Just call the number on your screen. Thanks for watching.